Hello, I'm Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. Last week, we got a couple. All the reports were normal, semen analysis, AMH, tubes, everything was normal. But they were advised to do IUI or IVF using donor sperm. We said why. Then we found that they have done one test called sperm DNA fragmentation test, and it showed that sperm DNA fragmentation was 60%. Therefore, they were advised donor sperm. Is it the right way? First of all, before doing any treatment or before doing any test, we have to understand when we should not do the test. Because sometimes doing the test can do more harm than good. Sperm DNA fragmentation, when we test it, when you have experienced recurrent miscarriage, repeated miscarriage, in that case, we can do sperm DNA fragmentation. Otherwise, sometimes if you have diabetes or varicocele but semen analysis is okay, then we can consider doing the sperm DNA fragmentation test. Otherwise, sperm DNA fragmentation test should not be done. Why? Because we don't know the exact treatment for abnormal sperm DNA fragmentation. Of course, if you have done sperm DNA fragmentation, if your weight is, you are having overweight, we will advise reducing the weight. We will advise cutting down smoking and alcohol, avoiding fast food, junk food, controlling diabetes and high blood pressure. And if you have varicocele, in some cases, we can advise surgery. And of course, if you are requiring IVF or ICSI for any other cause, in that case, we can sometimes collect the sperms by TESA from your testicles during ICSI if you have very high sperm DNA fragmentation. But believe me, many times, even when you have very high sperm DNA fragmentation, you can conceive naturally. In fact, many of our patients who have sperm DNA fragmentation, they have conceived naturally and their wives delivered healthy baby. Therefore, if you have sperm DNA fragmentation, there is no requirement of donor sperm. You can conceive naturally or can conceive by IUI or IVF using your own sperm. Therefore, please don't do sperm DNA fragmentation just because you are having infertility. You can do sperm DNA fragmentation only when you have experienced repeated miscarriage. Thank you for watching this video. If you have further queries, please don't hesitate to contact us through our Facebook page or YouTube channel.